If your hands and feet constantly feel thick, heavy, and muffled, almost like they're trapped inside wool gloves even when they're uncovered, I want you to stop scrolling for a moment and really pay attention. What I'm about to explain helped my 69-year-old patient restore sensation in her hands and feet in just 5 days, using something she bought at a regular drugstore for around $15. Patricia is 69 years old, and about 6 months ago, her life quietly began to change in a frightening way. While preparing meals, her hands would suddenly go numb. In the mornings, she'd lift her coffee mug only to have it slide out of her grasp and shatter on the floor. She completely lost the ability to judge water temperature and burned herself twice in the bath before her daughter stepped in and demanded she see a doctor. But what scared Patricia most happened after dark. She would wake up in the middle of the night with her feet buzzing and stabbing, like countless tiny electric shocks firing at once. Some nights, she couldn't feel her feet at all. It felt as if they were disconnected from her body, like they didn't belong to her anymore. Her family doctor referred her to a neurologist. After undergoing expensive nerve conduction tests and EMG scans, the neurologist sat her down and delivered the verdict: peripheral neuropathy. He told her the nerve damage was permanent, irreversible. There was nothing that could be done to repair it. Then he wrote her a prescription for gabapentin. Patricia stayed on that medication for 2 weeks. During that time, she felt dizzy nearly every day. She fell twice trying to get out of bed. Her balance became so unstable that her daughter feared she would suffer a serious fall. And despite all of that, her hands and feet felt exactly the same. No improvement. No relief. Nothing. That's when Patricia's daughter found my clinic and brought her in for another opinion. I'm Dr. Sandra Soretti, and for more than 2 decades, I've helped patients recover from conditions they were told were permanent and untreatable. And what I'm about to say may upset you, because Patricia's story is not rare. It happens every single day in neurology offices across the country. Patients are told their nerve damage cannot be reversed without doctors ever checking one simple, low-cost blood test that could completely change the diagnosis. Here's what I uncovered when I reviewed Patricia's case. There are 3 specific B vitamins that can help repair damaged nerves, something many neurologists insist is impossible. An improvement can begin in as little as 5 days. Now, I know what this sounds like. Vitamins? Seriously? That sounds too basic. Too easy. Like something doctors dismiss as the alternative or unscientific. But stay with me, because what I'm about to explain is backed by respected German clinical research and has already helped hundreds of my patients regain feeling in their hands and feet. Drug companies don't want this widely discussed. They make billions every year selling medications like gabapentin and Lyrica to neuropathy patients. These drugs don't repair nerves. They simply dull symptoms while the underlying nerve damage continues to progress. Here's the truth they rarely tell you. In most cases, peripheral neuropathy is not caused by permanent nerve death. It's caused by a very specific pattern of vitamin deficiencies, and those deficiencies can often be corrected quickly. I'm talking about 3 particular B vitamins, in precise forms, taken at exact doses, working together to rebuild nerve tissue from the inside. And no, this isn't expensive. Patricia spent $15 at a neighborhood pharmacy and began noticing changes within 72 hours. So if you, or someone close to you, has been told neuropathy is permanent, if you're dropping objects, if you can't sense heat or cold, if your feet tingle or go numb at night, I need you to stay with me. Because what your doctor didn't explain could completely change your future. Let's start by clarifying what peripheral neuropathy actually means. Peripheral neuropathy refers to damage to the nerves that branch out from your spinal cord into your arms, hands, legs, and feet. When these nerves don't function properly, signals don't travel correctly. That's why sensation fades, tingling appears, and temperature awareness disappears. Most neurologists explain it like this. The nerve covering has broken down. The nerve fibers are dying. The damage is permanent. Medication is the only option. But that explanation is incomplete and often wrong. In the majority of cases, peripheral neuropathy isn't caused by dead nerves. It's caused by deficiencies in 3 essential B vitamins your nervous system depends on. Think of your nerves like electrical cables. First, they need a signal carrier. That role belongs to vitamin B1, also called thiamine. Without enough B1, nerve signals weaken and slow. Second, they need insulation. That's vitamin B6. B6 supports the myelin sheath, the protective layer around nerves. Without it, signals leak and degrade. Third, nerves must be able to repair themselves. That function belongs to vitamin B12, specifically methylcobalamin. This form of B12 helps regenerate damaged nerve tissue. Here's the key detail most people miss. These vitamins must work together. Taking one alone isn't enough. Their combined effect is what allows nerves to heal. When I ordered Patricia's blood tests, the results told the real story. Her B1 level was dangerously low. Her B6 was below the normal range. Her B12 was barely half of what it should have been. She was deficient in all 3 nerve-critical B vitamins. And her neurologist never checked a single one. Instead, he relied on imaging and electrical tests, assumed permanent damage, and prescribed a drug that does nothing to restore nerve health. So how do these deficiencies happen? Diet plays a role, especially in older adults. But many people don't realize the common medications slowly drain B vitamins from the body. Diabetes drugs like metformin reduce B12. Acid reflux medications such as omeprazole lower B1 and B12. Diuretics deplete B1 and B6. Long-term aspirin use can also reduce B vitamin levels. Patricia had taken omeprazole daily for 8 years. Over time, it silently depleted her B12, without a single warning or test. That's the real problem. Now let's talk about the research. A major German study published in Neurological Research gave neuropathy patients daily doses of B1, B6, and B12. After just 3 weeks, more than 2/3 experienced significant symptom improvement. Nerve tests improved. Sensation returned. Tingling decreased. Even more impressive, many participants felt changes within the first 5 days. Because when your body finally receives the nutrients it needs, healing begins immediately. But here's what makes all the difference. The form of the vitamin matters. For B1, benfotiamine works best. For B6, the active form P5P is essential. For B12, methylcobalamin is critical, not the cheap synthetic version. Wrong forms mean wasted time and no results. When Patricia started the correct combination, this is what happened. Day 1, no change. Day 2, slightly less tingling. Day 3, she called my office crying with relief. Day 5, she could feel hot and cold water again. Week 2, her grip steadied. Week 3, numbness reduced by half. 1 month later, nerve function improved by 60%. She was told recovery was impossible. It wasn't. This won't fix every case, but for people with unexplained peripheral neuropathy, vitamin deficiency is often the missing cause. So here's what you can do. Look for a high-quality B-complex containing B1 as benfotiamine, 100 mg. B6 as P5P, 100 mg. B12 as methylcobalamin, 1000 micrograms. Take 1 capsule daily with food. Within days, you may feel change. Within weeks, improvement. Within a month, real progress. Today, Patricia cooks without fear, bathes safely, sleeps peacefully, and holds her grandchildren's hands again, all because of a $15 supplement. If this helped you, save this video. Share it with someone who needs it. This information is too important to ignore, and it could restore someone's quality of life.